see, there's a pent-up demand, like a lot of people, including me, haven't seen before. But this has to get through. They know they're getting through the crisis and will require an all-of-America approach, and that's very important. They're committed to remaining open during this crisis, totally open. They have to stay open. Those stores have to stay open. They supply our country. Our supply chains in America are the most powerful in the world, and they're all working very hard. They're working around the clock. And the stores are stocking up at a level that's beyond Christmas time. And it's great. It was very reassuring speaking to these people. They have it totally in hand. There's no need for anybody in the country to hoard essential food supplies. They said to me, could you please tell them, just go and buy, enjoy it, have a nice dinner, relax, because there's plenty. But you don't have to buy the quantities because it's hard to refill the stores on a basis as rapid as they're refilling them. And we're using the full power of the federal government to defeat the coronavirus, and we will do whatever it takes, and we're doing really, really well. A lot of good things are going to happen. I want to thank all of the people. These are phenomenal people, and there's some of them right over here. But the people behind me have been working round the clock, and they're doing an incredible job. We see what's happening. We see what's going on in other countries. We're looking we're learning from watching other countries, frankly. There's a very contagious virus. It's incredible, but it's something that we have tremendous control of. I think very important to young people of good health, and groups of people just are not strongly affected. Elderly people that are not well in certain respects are really a very dangerous group. We have to watch them. We have to protect them very much. We have to really watch over them and protect them because they are very vulnerable. And with that, if it's okay, I'm just going to go and make some calls. I'm talking about Federal Reserve. I think it's a tremendous thing that took place just now. I didn't know I'd be surprised on a Sunday. I don't know if that's ever happened on a Sunday before, but I would think there are a lot of people on Wall Street that are very happy. And I can tell you that I'm very happy. I didn't expect this. And I like being surprised. So our Vice President is doing an incredible job. He's going to take over. And I will see you probably tomorrow. Thank you very much.
Thank you, Mr. President.
And he'll be happy with that.
And good afternoon. With more than 2,900 cases of coronavirus in 49 states across the country, I want to assure the American people that this administration, all of our partners at the state level, and local health officials have no higher priority than the health and safety of the American public. At the President's direction, we will continue not only a whole-of-government approach, but as we'll discuss today, we'll continue to build on a whole-of-America approach to confront the coronavirus across the country. The health experts continue to confirm to us that based on the latest information,
31 feet out here,
for the American people as a whole, the risk of serious illness remains low. But because the risk is heavily weighted to the most vulnerable,
looking like 8 feet to the
people
cup here,
with immunodeficiencies and to people who are elderly with serious underlying chronic health conditions. Our administration, and I know state administrations, will continue to focus on the most vulnerable, and we will continue to urge every American to be vigilant in practicing good hygiene, taking the advice of the CDC and local health experts to keep those most vulnerable safe. I know I speak on behalf of the President and our entire team when I say how grateful we are for governors all across the country and the seamless partnership that we have forged with them and with state health officials, with our federal team. I spoke today to Governor Pritzker of Illinois, and we are in continuous communication with governors a phone call away.
Starting the day off at
they know
1:05.
that they can contact us and address
And now setting up
even
for
the
this par
smallest
5.
need. Because as a former governor, I know firsthand that when it comes to health challenges in America.
Looks like he's going through the
Our
branches here.
states are on the ground in the lead, our local health organizations.
Yeah,
and
he's
we've
probably
built a
not
great
happy
partnership.
about that shit.
We also want to express great appreciation to the American people. Not surprisingly, it is inspiring to see the way tens of millions of Americans are responding with compassion, with common sense, and we want to express particular gratitude to communities of faith that participated in today's National Day of Prayer. We've seen places of worship implementing policies to keep those most vulnerable safe, and also we've seen communities of faith already stepping forward to support and to encourage those most vulnerable. I heard tell of a church back in Indiana that's actually no longer having services till April 10th.
And nothing wrong with that, Chuck. And the ball's currently sitting in that pine straw. Let's see what happens.
Central Indiana. And churches all across the country are taking the opportunity to reach out and put feet on their faith, and it's truly inspiring. As President mentioned today, he spoke today to leaders in the grocery store industry, where people buy our food, and we heard and we're reminded that America has the most efficient and effective supply chain
that is some
in the world.
fantastic club work on this par 5 green, hitting it in 2. Okay, and about 205 yards
from those grocery store executives that stores will stay open throughout the days that lie ahead. We were told that hours may be reduced to allow for cleaning and to resupply, but American families can be confident your local grocery store is going to be open, it's going to be well supplied, and they specifically asked us to encourage Americans just buy your weekly needs in grocery, because the grocery stores will remain open. Also, very movingly, those same executives all reiterated their commitment to continue to support local food banks in the way that our grocers continue to do around America. Tomorrow, the President and I will be briefing all the nation's governors, states, and territories, and the District of Columbia. We'll be speaking about the progress that we're making, and we'll be speaking to them specifically about our widening partnership on expanding testing to the American people. So allow me to speak to that issue, and then I'm going to recognize Admiral Brett Huar, who will describe for us the excellent work the Public Health Service is doing. Dr. Burks will describe the importance of the new National Public-Private Partnership for Diagnostic Testing that is going to open the door to thousands of more tests in real time for the American people in the days ahead. First,
this
fundamentals.
Is for the Eagle.
As the American people know, testing is now available in all 50 states. Either state labs are either conducting the tests themselves, or the CDC is processing tests. They're using the traditional manner of a manual test that allows for 40 to 60 tests a day. It is among the reasons why the President several weeks ago tasked this group at the White House to reach out to commercial labs around the country and forge that public-private partnership that would bring the high speed, or more accurately, the high throughput testing for coronavirus available in real time. And based on the unprecedented speed of the FDA, which last week approved high throughput coronavirus testings for Roche and Thermo Fisher, we will now have access in the days ahead to more than 2,000 labs across the country that have the equipment today
to
process coronavirus tests much more rapidly and a much higher volume for the American people. In terms of delivering those services,
not the greatest
more than 10 states, in addition to CDC labs, public health labs, and labs that states can now authorize in their states, more than 10 states have implemented their own drive-through testing sites, and we want to commend New York, Colorado, Delaware, Washington State, Texas, and others that have implemented these on-site places where people can obtain tests. Most are using the current CDC testing, manual testing, but we are working closely with our governors, as you will hear momentarily, to make sure that the new testing regimen is available for their remote sites as well. As I mentioned, As of Monday, we will have more than 2,000 labs coming online with the high-speed testing, and we are connecting states to those testing methods. We're also working with a number of retail partners to add to the work that states are doing around the country, working to set up parking lot testing centers outside of stores, and Admiral Brett Garrar will detail the progress that we've made over the last 72 hours. Following the President's declaration of emergency, the Admiral and our Public Health Service have forged a partnership now with FEMA, made possible by that declaration. And they've reached out to all 50 states to create a process that will enable all Americans who need to be tested to go to a community-based testing site outside of usual healthcare facilities. The focus of these tests, as Dr. Birx will describe momentarily, will be on those most in need. A priority will be placed on healthcare workers and first responders who are out there coming alongside people that are being impacted by the coronavirus. We want to make sure they have access to the testing as a priority. And then Americans 65 or over with a cough or a fever or other symptoms will be prioritized over other tests.
And he won't be too pleased.
As I mentioned, Admiral Garrar will describe the progress that we've made in just a few moments, but we're going to continue to work very diligently, hour by hour, day by day, in the days ahead, to expand testing.
I think this shot might have a bit too much clump.
This extraordinary and unprecedented national public-private
And
partnership.
he's got to be happy with that.
Testing.
This next one coming
with
out
regard
of the
to
rough.
testing, as we expand testing, we're so pleased that Congress joined with our administration to make sure that cost is never going to be a barrier to anyone getting a coronavirus test. As you recall, several weeks ago, the President directed a change in our Medicare and Medicaid programs to ensure that coronavirus testing was included. Health insurers were brought in. They all agreed to waive copays, but because of the good bipartisan work done in the House of Representatives, now all coronavirus testing is free, and it's free for every American, including uninsured Americans. And we continue to urge passage of the legislation that will be considered by the Senate this week.
And I think you'll like that.
Let me say one final word
and this
about the testing issue. And that is that we, as the President often says, we're all in this together. And it's absolutely important that as we expand testing resources across the country, beginning by prioritizing the areas that CDC and our state leadership tell us are most important. It's important that the tests are available for people that are most in need, and for our healthcare workers and first responders that are helping them and supporting them. As Dr. Birx will describe, the testing that is available should only be done if for any reason you think you may have the coronavirus. We encourage people to consult their doctor, and if you're symptom-free, we
inches away.
Work with us to make sure the testing is available for people that are experiencing symptoms. It's extremely important that we have
and about
the
13 feet away
cooperation of every American as we expand testing and make it available during this challenging time in the life of our nation. With that, I'm going to ask Dr. Birx, I'm going to ask Admiral Brett Garrar,
he's going to go down
Public Health Service, leader of this great commission corps behind me, to come up and describe the extraordinary work that they have done over the last 72 hours and will be doing each and every day in conjunction with our states
looking pretty good.
To expand testing to community-based testing across the country for the American people using this new public-private partnership diagnostic testing. Admiral?
Thank you, Mr. Vice President, and thank you for your personal interest and support of our team over the last 72 hours as we worked on this critically important project. So as the Vice President said, over the past 72 hours, we have developed and are beginning to implement now a process and a program of testing that will enable Americans who are in need of coronavirus testing to be tested effectively and efficiently according to a few principles. Number one, we want to assure that those most vulnerable and those impacted are able to be prioritized. Number two, we don't want to do testing that in any way threatens the acute care system.
130 yards.
In other words, we don't want people going to hospitals and acute care clinics where, number one, they could infect other people or subject themselves to infections. And number three, we want to balance the needs of across the entire healthcare system among diagnosis but also treatment. In other words, we want to balance the stress on the strategic national stockpile and all our throughput tests
I think you'll
available
be happy with
this week,
that.
with
This pipe
numerous
is for
labs
30.
up to 2,000 starting to turn the lights on beginning this week and rolling out over the week. That is really a game changer for us because the back of the shop testing capability is there. The front of the shop is what we've been really working on. In order to get a test there, you've got to be able to swab individuals, get them into the system without completely paralyzing the entire healthcare system as we have. So, with the emergency declaration, this was very, very important to us because it really enabled the historically effective processes of working and empowering states, federally supported state-led efforts through the normal FEMA mechanisms. So for the last 72 hours, representatives of FEMA from across the government and our Commission Corps have been working on joining the unique and unprecedented public health mission with the historically successful mission of
doesn't drop.
Of personal distribution centers, places for distribution, the pod system of FEMA. Our public health service, we've already deployed over 1,000 officers in support of the coronavirus missions. That includes to the Diamond Princess, to the borders, to the quarantine stations, to the acute care settings where we're caring for nursing home residents in Seattle. So we have a very experienced group who brought these together. So what we've really designed and how we're working with the states, we have contacted all 50 states through the FEMA system, every single region, every single state to understand where they are. As the Vice President said, some states are rolling out some of their own community-based testing. They need to be augmented. We believe we've created a model based on the public health and the FEMA system that is optimized, that can be used for drive-through or potentially walk-through.
Powerful drive.
Each of these pod-based units, we believe, can screen 2,000 to 4,000 individuals a day for testing with all the appropriate personal protective gear, all the appropriate back-end and linkage to the public health system, including testing. We know that we have the logistics to do that. We know we have the materials to do that. And again, this is federally supported, state-led efforts. Many states need the full meal deal. They want dozens of public health service officers to work in protective gear to actually test. They need supplies like protective gear. They need swabs. They need logistical support.
I think you'll like that.
Other states only need a fraction of that. They may have all the personnel, but they really need the know-how, the template, and some of the gear that we provide. We are going to start implementing this system this week in a number of states, primarily those that are the hardest hit right now or are on the rise. And the CDC advises us that that's when they need the testing. I want to emphasize again that we're focusing on two very important groups, and you'll hear this said 3 or 4 different ways, and the groups that really can be the most impacted or impactful in our outbreak. Number one is healthcare workers and first responders. This is very important for 2 reasons. Number one, we have to take care of the healthcare workers and responders because when America needs them, they need to be available, healthy to provide the care that we all deserve. But it's also important that if they feel they have a risk of having contacted coronavirus, that we test them so they cannot spread that, for example, in long-term care facilities where the elderly are. And the second group would be the elderly. And we are classifying that according to risk as those 65 years of age or older who have a respiratory symptom and a fever of 99.6. That's a lower number than you've seen before because those who are older do not spike high fevers like children do, 104, 105. So you set the bar just a little bit lower. We do that because we know that they're at high risk of bad consequences, and if they test positive, they can engage with their practitioner, telehealth provider, or get in the system to make sure they have just an outstanding outcome. So that is really where we are. We've made really unprecedented progress. You will see these sites rolling out progressively over the week. This is not make-believe. This is not fantasy. We've developed the model. We've talked to the states. We're focusing them on specific locations now. We will start shipping gear, stuff tomorrow. We will start deploying officers tomorrow and Tuesday, and we'll begin seeing these sites in addition to the ones that are springing
probably
up now,
not too pleased with his performance there.
We will have the capability of testing tens of thousands of additional people
Now
through these sites
out of the
every week, in addition to all the capability that's now going to be distributed in the 2,000 laboratories and the major central core laboratories. And I know you have a number of questions that hopefully in the question and answer session we'll be able to answer for you. But I think this is just a great linkage. I'm a pediatric ICU doctor. I take care of sick people. I know what happens when you get respiratory illness. The Surgeon General is an anesthesiologist who takes care of people who have respiratory difficulties and manages that. So we know how this works. We've been there. The most important thing we've worked on right now is making testing accessible because of the advances of the FDA and private industry to make these high throughput tests. Now we can work on the front end. With the emergency declaration, we have all the tools, and all of government has really come together with industry, not just government and states. It's really been private industry, the manufacturers to bring the swabs, the personal protective gear, the laboratory testing, the shipping, the fronts with Walgreens and Walmarts working as potential sites. This has been something in my mind has been unprecedented. The entire society approach working so intensely certainly over the past weeks, but incredibly on this project over the past 72 hours.
Thank you, Emma. And let me say, we are moving out now that we have the public-private partnership with the major commercial labs. And now you have our public health team as well as FEMA moving out, connecting to the states to deploy these point of distribution community centers. We'll also be working closely with members of the media in individual jurisdictions, as well as we're working with Google and other tech companies to make sure that there's online resources where people will be able to readily access a questionnaire that will walk them through the symptoms and whether or not a test might be indicated. And also, in the days ahead, we look forward to that same website being able to direct people to the nearest community center or drive-through center that's available. But let me introduce Dr. Ditterbergs to speak about that patient experience and about the importance of the right people seeking the testing in the days ahead. Doctor?
Thank you, Mr. Vice President. Let me just start by recognizing the men and women of the military who are serving us every day. They are my brothers and sisters. I was privileged to serve alongside them for quite a long time. But critically, I just want to recognize at this moment the Public Health Commission Corps behind me. The Vice President, although he didn't speak to this, actually went to see them yesterday at the place where they were working so that we wouldn't disturb them because of their level of dedication and work through the last really 48 hours nonstop. So thank you for your work, and thank you for the work that you brought together, and thank you, Admiral, for explaining it so quickly. Let me just go back to the way laboratory work is done in the United States. I think all of you know, when you go to your doctor and you need a lab test, it is either done in your doctor's office or it's done in the lab that they send you to. When we started this emergency response to this virus, we started with what we knew, and that was the flu platform that we used for surveillance. It wasn't set up in your doctor's office. It wasn't set up in our hospital laboratories. It was set up in state and local labs and at the CDC. Over the last 2 weeks, we've been working with the groups that have served you for decades, the commercial laboratories that you don't see, but your specimen goes to ensure they had the full capacity to meet the needs of the American people. Because it wasn't going to be 50 to 100 to 1,000 tests. It was going to be tens of thousands of tests that would be needed to be done. And so the last 2 weeks has been spent on really getting what you are used to, the full force of the clinical laboratories at service. At the same time, what you heard described here is how do we serve the needs of the people in the community,
7
where
feet
they reside,
to the cup.
where we know when we're talking about people with vulnerable conditions, immunosuppression, medical conditions, or the elderly, that we don't want them having to sit for long times in doctor's office and hospitals' waiting rooms. And you see what state and local governors have done to move past what we would normally do, a referral to your doctor's office and to your hospital, but really providing community-led services to provide this testing. What the federal government is doing is augmenting that, augmenting the innovation that existed in South Korea, brought here to the shores of the United States, and brought in our own novel way, but utilizing our healthcare delivery system, which is different than South Korea, and adapting our work to our system. So, to the hospitals and to the laboratories, we know that there will be pent-up demand for this. Make sure every hospital, every laboratory, I'm speaking to the people who work in labs like I did myself, make sure you have enough pipette tips, pipetters, and all of the equipment that you need to run this laboratory. You know what you need. Make sure you have that and have that available for these tests. Because we know with this increased sampling, this increased ability to have community access, additional samples will be going to these laboratories. They can manage the high throughput, but they need all of the supplies that they would normally need to run these tests. Think of it, if you're doing HIV viral load, same thing. Just what you need. You know what you need. Make sure you have that. That will be run, and the most important thing I know for each and every one of you is how am I going to get my results? And so we're making sure also that the end of reporting is also there, that the reporting is available to you, to your doctor, and also to the state and local governments and the federal government, not with your personal identifiers, but to really understand where there are positives, where there are negatives, so we can assure that healthcare providers have what they need to meet the demands of the American people and their health needs when they're there. Now, let me just say one thing about reporting. So you will notice as these tests roll out over this next week, we will have a spike in our curve. For those of you who watched China and China reporting, remember when they changed their definition and all of a sudden there was a blip in their curve? We are going to see that. We are going to see a spike as more and more people have access. And I want to finish by again reminding people how important it is. I know everybody's going to want to go to these drive-thrus, but if we could prioritize, like we have asked you to prioritize the care of every person with a pre-existing condition and immunosuppression and the elderly with existing conditions, we've asked you to prioritize them. And we ask you to prioritize them in the lines so that our first responders and our healthcare providers and everybody who has difficulty to get to doctors' offices can utilize this system while we bring all the other traditional systems that you are used to and have availability for you online over the next few days and weeks. So thank you for constantly reminding us how important it's a response of all of America for Americans.
Quite sure here it could end up in the fairway.
All of America for Americans. It's a privilege to be part of this solution and be part of this team. And again, I want to close by recognizing the Commission Corps. They have spent, I'm not sure they had anything but pizza to eat for the last 2 days, but we appreciate greatly. All right, don't follow their guidance.
Thank you, Mr. Vice President. I'll be very brief. I just want to say, listening to the description of Atmar-Joie, I'm very pleased to see how things have evolved. I think we could describe this as entering into a new phase in the testing space available here in the United States. You've heard me on many of these briefings talk about the multifaceted armamentarium that we have to address the crisis of what the world is seeing and the challenge that we're seeing right here in the United States. I mean, obviously, the travel restrictions have been, in my mind, a very, very positive way that we have prevented more of the input from outside in that would see us and make our job more difficult. And then we have, as I've mentioned, the containment and the mitigation from within. You're going to be hearing more about advanced guidelines about that, more precise instructions of how we could implement this mitigation within
Yeah,
the
he's probably not too
community.
happy about
But
that.
now that we have a situation that is going to be rolled out, and remember, I want to emphasize what was just said. We're not going to go from here to there overnight. It's going to be a gradual ratcheting up that I believe is going to happen quickly, so that then we can start talking about things and put behind us the multiple understandable questions about testing and move on to see how we can make this multifaceted approach really work for us. Because as I said many times, and I'll repeat it, the worst is yes ahead for us.
This is not
It
what
is
you
how
do.
we respond to that challenge that's going to determine what the ultimate endpoint is going to be. We have a very, very critical point now. If you look at the curves that I've described multiple
Right now,
times,
setting up his
this
sand
window
trap.
that we're in is going to be very important for us to stay ahead of this curve. Thank you.
Questions?
Mr. Vice President, we've seen a number of communities across the country that are starting to either close restaurants, some are even doing curfews. Do you envision this happening kind of nationwide, where you'll see some rules come to effect saying, we don't want people out at places that are not essentially a Walmart or a grocery store or some kind of testing center? And then also, I would be curious to see, we've also heard so many travelers today that were coming back from these airports that, well, they were flying
Out
back,
of
they were so
the
concerned.
sand trap
I'm sure
into the
Secretary
beach.
will address it, but these folks that are wondering now, did they catch it because they were stuck waiting in
And
line for
hitting
hours
out of
customs?
the pine straw right now.
Well, we'll have updated guidelines tomorrow morning for you that are being vetted now with CDC and all of our top healthcare experts. But what I would just recommend to the American people is to review those federal guidelines.
And pretty sure he's going to like that.
Respect and defer the decisions that are made by governors, by state health departments about what's best for that community. What my health care team, some of the best people in the world, tell me very regularly is that it's very important that you follow the data. You make decisions based on the circumstances that are taking place in that community. And but we'll have more broad-based recommendations for the American public tomorrow. And let me say, I'm going to ask the Secretary to come up and speak about
15 feet away here.
the screening issue. The President made a decision to
This shot could be just right.
From Europe.
That one goes in. The bird.
It's underway now. And as of midnight Monday night, we will be suspending all travel from the UK and Ireland as well. But Americans may come home, but out of an abundance of caution, we are engaging in healthcare screenings at 13 different airports around the country. We're working diligently in that regard to put the safety of the American public first, and we're asking returning Americans to self-quarantine for 14 days if they've been in those countries in Europe, and as of Monday, the UK and Ireland that are being impacted by the coronavirus. But the Secretary and I spoke this morning. I spoke with Governor Pritzker and Senator Richard Durbin of Illinois this morning about some challenges at O'Hare Airport, and I'm going to let the Secretary speak to how we are addressing those going forward. Secretary?
Well, yesterday we began processing, again, the travel restrictions from passengers from the Schengen area, which totaled more than 40,000 passengers yesterday. To give you an idea, one day we processed over half of the total number of individuals we have processed medical screening since February 2nd. So that is an enormous challenge that we have placed on our officers and contract medical staff at airports, and they are stepping up. But to be clear, the lines, again, that we saw overnight at a limited number of airports, including Chicago,
can't be very pleased with himself after that.
Acting CDP Commissioner Morgan also believes they're unacceptable and has personally engaged leadership at all 13 funneling airports. We did make the necessary adjustments at 12 of the funneling airports. However, again, at Chicago, those adjustments were not made quick enough, but we have course corrected. We've adjusted our processes. We continue to surge personnel. And we are certainly glad to see certain airports and certain airlines step up, partner with us, and help address this unprecedented situation. As I walked in here today, so far today, at all of our funneling airports, to include Chicago, we have an average wait time of 30 minutes. So we addressed the problem, we identified the problem, addressed it, and we have fixed it. And we look forward to, again, accommodating passengers this evening as well. I understand the frustration that some passengers who are returning to the U.S. might have with some of these procedures, but I would just say and rest assured that we are continuing our strict protocols of looking at individuals as they come into the country, make sure that they are medically screened, make sure that we are capturing the information for the public health officials, the state and local officials, and we'll continue to do that. We've done that specifically at the president's request.
Mr. Secretary, has there been any talks or any sort of shutdown of domestic air travel at all?
Well, we continue to look at all options, and all options remain on the table to address, and we'll certainly adjust as the medical professionals at CDC address the medical situation.
Good job.
Mr. Vice President, Dr. Fauci this morning said that the federal government should do whatever it takes
That was hit out at some very, very deep breath.
Social distancing and encourage that practice. He didn't rule out the possibility of a national lockdown. If Americans don't take those steps on their own, is that something that the federal government is prepared to do? And secondly, I'd also like to know, the president, we just heard him say Americans should relax.
Now that shot has ended
about what Americans can do as they are seeing this huge impact on their daily lives, whether it's at airports or at restaurants or other places around the country.
Well, everything that the White House Coronavirus Task Force does is at the direction of the President of the United States. All the efforts of all federal agencies in cooperation with state governments and local health officials is reflective of the decisive leadership the President has brought this early on. It's important to remember that the President on January 31st suspended all travel from China. I said to Dr. Fauci, who I'll call up to address your other question in a moment, I said to Dr. Fauci today, as we look at Europe now being the epicenter of the coronavirus, that I asked him if we had not suspended all travel from China, what our circumstance would be, and he essentially said, we'd be where Europe is today. And the President also took the actions with regard to Europe and recently expanded those. So the American people can be confident that President Trump is going to continue to act without hesitation on the advice of our healthcare professionals to put the health and safety of the American people first. But with regard to the statement that you made, I'm going to let Dr. Fauci address that as well.
Yeah, I meant everything I